High blood pressure is called the silent killer, but the real killer is how it starts, quietly and invincibly, from stress that you didn't even notice. When stress hormones flood the body system, they narrow and harden the blood vessels and force the heart to pump even harder. At first, the rise in blood pressure is subtle, almost unnoticeable, but the blood pressure fails to drop to its normal baseline, setting a new higher normal level in the body. These small increases trigger inflammations that damage the inner lining of blood vessels, thereby creating a fertile ground for disease conditions to thrive. Let's consider a simple life scenario. A woman who is under constant work pressure and checks her blood pressure once in a while. It's fine, she says. But meanwhile, internally the silent battle rages on. Tiny tears and lacerations form within the inner walls of the blood vessels, and then inflammation gradually builds up. The production of nitric oxide is reduced as well. This makes the blood vessels to stiffen, become brittle, and unable to relax, leading to a rise in the blood pressure. Other vital organs as well are quietly stressed without warning. You see, one major problem is that hypertension often causes no symptoms, while damaging the heart, the brain, the kidneys, and the eyes. Most people discover it only when complications have occurred. Remember, you feel fine on the outside, but inside your body is quietly under siege. Don't forget, high blood pressure doesn't just stay in the arteries. It makes the heart to work overtime. The kidneys are strained as well, and the brain is at serious risk. Medically, it is often called primary hypertension because the cause is subtle and cannot be traced to any underlying disease condition. Things like lifestyle factors, stress patterns, and diet are usually overlooked, but they form the key factors to be considered as far as hypertension is concerned. By the time symptoms like headaches or dizziness eventually appear, damage is already underway. So let's talk about breaking the chain. Interrupting this process requires a conscious shift in our daily habits, and the first step is simple: know your numbers. So many people haven't checked their blood pressure in months or even years. They feel not knowing what's going on makes it easier on them. But remember, being in the dark doesn't make you safe. If you have a family history, or experience chronic stress, or you're struggling to balance a demanding lifestyle, regular screenings are your early warning system. The second step is what we call the DASH approach, DASH, which stands for Dietary Approach to Stop Hypertension. Don't let the medical name confuse you. It's just a scientifically proven way of eating that can naturally drop your blood pressure numbers in as little as 2 weeks. Think of it as giving your blood vessels a break. Here we drastically minimize the foods that cause inflammation and stiffness, such as table salt, fried foods, sugary drinks, and heavy fats. And instead, we flood our body with things that help our blood vessels to relax and widen, such as plenty of vegetables, fresh fruits, whole grains, lean poultry, and healthy fats like extra virgin olive oil. Studies have shown that this simple shift in what you eat can drop your top blood pressure numbers by 8 to 14 points. This is a massive change, and it works entirely by easing the workload on your body system. Finally, if you're prescribed the medication by your healthcare provider, stick to the plan. Consistency is just as important as commencement. Don't stop taking the medications just because you feel fine. High blood pressure is easiest to stop before it permanently damages an organ. And if you feel the medications are beginning to make your blood pressures to become consistently low, don't start skipping your medications on your own. Go back to your healthcare provider who prescribed the medications, and they will review your dosages and the treatment plan. And that will enable you to gradually and progressively manage your high blood pressure. If it would interest you to know how high blood pressure slowly reshapes the heart, leading to potentially life-threatening consequences, then you wouldn't want to miss the next episode. If this video helped you connect the dots, do well to share it with someone you care about. Don't forget to hit the like and subscribe button to join us, because understanding the chain is your very first step to breaking it. See you in the next episode. Shalom.